Hi and welcome to everyone. I'm delighted to be present here today at the first ever edition of the Alpha Whale Tank for District 3141 of Rotary International.
We're most grateful for the participation of the 4 whales who enthusiastically agreed to be part of our first Whale Tank edition. To know, Natasha Raj, Head Human Resources and CSR at HDFC Credilia Financial Services Limited.
Our next whale is Sapan Choksi, CEO of Systems Plus.
Our next whale is Pradeep Gopalkrishnan, Chief Risk Officer for Deutsche Bank AG, India.
Our next whale is Chetan Mehra of Weisman Group.
Good afternoon, whales. I am Manish Khemka, coming from Rotary Club of Mumbai, Warsaw. I am the president, and he is Rotarian Rajesh Chaudhary, our non-medical director.
Hi whales, we are here to seek 14 lakh rupees for our project Go Shunya. So the problem, everybody knows about it. In Mumbai, we generate about 10,000 tons of waste every day, and of which that is about 500 grams per person per day. That's the waste we generate. And about 70% of that is solid waste, and about 15% of that is dry waste, which today, in today's scenario, it's all getting clubbed with the wet waste and going together, into the municipal vans and also the project. Basically, we are aiming to, with the project, we aim to segregate the dry waste, and only the wet waste can go into the municipal vans. So basically, we will want to reduce the load on the municipal collection vans, as well as create a system where the segregation of waste can be done at the household level, which today is largely missing because BMC does seamless collection of waste from the households on a daily basis. 15%, so on an average, one family generates about 1 kg of waste per week. Project aims at being an aggregator and segregator. So we have no such facility today of removing the dry waste first and foremost, and wherever it is removed also. So plastic waste is separate, paper waste is separate, and other things, bottles and newspapers and everything is separate. So you have so many agencies wanting to have that pie. That for plastic, of course, and for e-waste, there's a demand. But at the same time, there's nobody aggregating this entire waste into one and then segregating. So our project aims at becoming aggregators and segregators. And so what we are aiming to do also along with this is creating employment. So it's addressing a community problem that is there. Today, rag pickers are totally unorganized. We want to bring them into mainstream, where we would eventually get them into e-Shram and other Jan Dhan programs of the Government of India, which is there. So this is one project where we are looking at targeting about 15,000 families. 15,000 families will generate about 60 tons of dry waste every month. And this dry waste will eventually get monetized. So the operation cost is totally taken care of. It's a purely sustainable activity. There's no problem on that. So that is the first step. And we are looking at starting this as a first pilot with about 15,000 families. We can optimize to maybe 20,000 families going forward, but we will create awareness amongst these people, amongst the community to segregate. The process would be basically the drop boxes will be kept in the societies where, so these are perforated boxes so that wet waste doesn't go into it, and only the dry waste will be there, and the collection will be on a daily basis, on a rotation basis. The idea is to create multiple collection aggregation centers and segregation centers rather than have one common, maybe in Wada or Palghar or somewhere where the trucks are going and dumping. So in each ward, we might have 2 or 3 centers so that the transport time is less for aggregation, and then it goes into segregation. So this is the macro benefit. Eventually we aim to do zero waste city. If Indore can do it, why can't Mumbai? So Indore today is literally a zero waste city, and Mumbai definitely can achieve it if all the citizens participate in this exercise.
So I think you are addressing a very good need, because all this leakages and all can be prevented, and probably a society such as Lodha could do very well when you have few hundred apartments, and this can be huge.
Yes.
I also see this segregation self-sustaining, in another project at Kashet Beach,
Okay.
where they have all the plastic from Mumbai coming in
Yeah.
during the monsoon time, and there is this aware group of citizens who
Right.
get it collected, sold, and that money is used to
Absolutely.
further fund. So I can relate with this.
Yeah. So what we are doing generally is we are coming before BMC comes in. So we are not going to sign any MOU with BMC. We are coming in before BMC comes in, and that is why we incentivize the
It's
building
good that you are
housekeepers.
incentivizing.
Yes.
I think that is well thought of.
Yes. Yes.
Existing dumping yards, Devnar, you work there.
No, so that will still happen. My point is we will reduce that load by at least 15%, and also the garbage vans which are running on the roads, that much time they will spend less on the roads, because they will be able to pick up more stuff, at least by 10% or 15% that we are picking up. So even the garbage vans will be that much, I mean, the consumption for BMC, it's a win-win actually, because as a corporation level, because they'll be spending less on diesel, plus the dumping grounds will have less pressure.
I was asking, 14 lakhs is enough?
Yes, so one van, we will have one van or two vans maybe. So one van of 1 ton each we are proposing right now in this, but we could have two vans. Two vans will mean actually more manpower in terms of driver. But two EVs, one EV is about 8.5 lakh rupees, all taken together, the body and everything, and including the branding that Rotary needs, and also probably the company also would have branding needs there. Then the boxes, about 2,500 boxes, we will be, sort of 250 boxes for each society, so about 2,000 rupees each. So that's about that cost which is there. For 5 lakh rupees is the cost.
Yes. My worry is you are actually snatching away the resources from the BMC personnel.
No.
By doing this. No, let me complete. So you see this, as I mentioned to you about that mafia.
Yeah.
So I don't want tomorrow them to pressurize in such a way that I'll only lift your wet waste provided you do the dry waste as well.
So right now with big societies, BMC is not picking up wet waste also. They have asked them to install composters in the buildings.
So are you going to focus only on big societies?
So we are right now looking at bigger societies, 100 plus flats societies.
That's interesting.
Yeah. So
has this model actually worked in any of the tier 1, tier 2 cities in India? You mentioned Indore as one of the examples.
Indore, because the whole initiative came from public.
Yeah.
So it was a great public, initiative and awareness that public had created. Mumbai is like full Australia. So it's impossible. I mean, today I work on rainwater harvesting. To tell a society to put a just rainwater harvesting system of 25,000 rupees, that's impossible.
Thank you so much.
You
Thank
really
you.
thought
Thank
through
you very
that.
much.
Thank you, Manish.
Thank you.
Thank you so much.
No, I think this is a great initiative done by the club. We have not got commitment, but based on the questions, we feel confident that.
Very hopeful.
Prerna began its work about in 1986, where we started working in the red light area to improve the situation of children. So when we started our work, what we realized was that there were no services for the children of women who were prostituted into the sex trade. So that's from where our entire work started. We began with a night care center in Kamatipura and Falkland Road red light areas, where services would be provided to children where there would be educational services, nutrition services provided to children, and over a period of time what we also realized was that along with children it was important for us to work with the mothers as well. So we started working with them on parenting skills, on developing their skills and empowering them to look after themselves. Even small things like getting social security documents, getting their bank accounts made, trying to help them save a little bit, and so that the debt that they are into with the brothel keepers, that gets reduced. There will be one section of the society, one specific category of children who would require shelter homes, but still it is good to have services available to the mothers in the community. So these are Prerna's projects where we have a night care center, we have education support for them, there's nutrition for them. Then we have an anti-trafficking center which specifically works with children who are rescued from the sex trade. Then over a period of time what we realized was that children from red light areas, once they were placed in institutions, there was a lot of discrimination they were facing because of the work that their mothers did. So we did, for a certain period of time we did try and sensitize people from the homes themselves, authorities, the police. And then we came, once the Juvenile Justice Act came out and we had the Juvenile Justice Rules, which defines minimum standards of care for children. That's when we also intervened, and we planned to make a model home of itself. So we have this children's home named Naunihal, which is in Kharghar.
It started in October 2001. सो नौनिहाल जो प्रेरणा का एक ही ऐसा प्रोजेक्ट है जो 24 आवर्स का शेल्टर फैसिलिटी है. जैसे रश्मि ने आपको इंट्रोड्यूस किया कि जुवेनाइल जस्टिस एक्ट के तहत ये प्रोजेक्ट चलता है. सो जैसे कि रश्मि ने कहा कि सारे बच्चे जो होते हैं ये कुछ ट्रॉमा उन्होंने फेस किया होता है ज़िंदगी में, जिसका रीज़न होता है कि वो इसमें आते हैं. सो चाइल्ड इन नीड ऑफ केयर एंड प्रोटेक्शन का जो डेफिनेशन है जुवेनाइल जस्टिस एक्ट के अंदर, उसके तहत एबेंडन बच्चे हैं, जो गुमशुदा हुए बच्चे हैं, एब्यूज़ के केसेस है, चाइल्ड मैरिज, चाइल्ड लेबर, इस तरह के केसेस हमारे यहाँ आते हैं. तो जो लॉन्ग टर्म वाले जो बच्चे होते हैं वो हमारे लिए ज़्यादा मतलब चैलेंजिंग होता है, क्योंकि उनका जो रिहैबिलिटेशन है उसका प्रोसेस में हम रहते हैं ज़्यादा. सो यहाँ पे जिस तरह की सर्विसेज दी जाती हैं, जहाँ पे लीगल एड दिया जाता है बच्चों को, काउंसलिंग सर्विसेज दी जाती हैं, मंथली डॉक्टर्स विजिट होते हैं, उनका न्यूट्रिशन, मेडिकल देखना पड़ता है. अनवेड मदर्स के केसेस आते हैं, केस इतने सेंसिटिव होते हैं कि उनका ट्रैवलिंग भी आप पब्लिक ट्रांसपोर्ट से उनको नहीं लेके जाते हैं, तो उनको कम से कम 2 से 3 स्टाफ एकम्पनी करने पड़ते हैं. तो ये कुछ हमारे चैलेंजेस है. तो इसके लिए हम जैसे कि अगर कोई बच्चा हमारा डिस्चार्ज होता है, डिस्चार्ज माने चाइल्ड वेलफेयर कमेटी की ऑर्डर से बच्चा जब उनके फैमिली में जाता है, अगर ऑर्फन है तो आफ्टर केयर फैसिलिटी में जाता है, या वो ग्रुप होम करके रहते हैं, जो हम ही मतलब हम उसको असिस्टेड लिविंग फैसिलिटी बोलते हैं, जिसमें हम सपोर्ट करते हैं. और ये एक्स रेसिडेंट्स है, तो इनके साथ भी हमारा ज़्यादा काम होता है. फिलहाल हमारे पास स्ट्रेंथ कम है, लेकिन अगर आप एक्स रेसिडेंट्स की जो हम फॉलोअप कर रहे हैं वो देखेंगे तो मंथली हमारा 70 to 75 का काउंट है जिनके साथ हम फॉलोअप करते हैं. मतलब ऐसा नहीं है कि जुवेनाइल जस्टिस से बच्चा निकल गया, चाइल्ड केयर इंस्टीट्यूशन से बाहर गया तो हमारा काम खत्म होता है. ऐसा नहीं होता है. हम उनका फॉलोअप 5 साल 10 साल तक भी रखते हैं.
You know, the child is asked to mold according to the resources available in that home. Here what we try to do is that we try to see how those resources can actually be pulled into and mobilized to address the needs of the child. So even if, like we've had children who might have wanted to say join a karate class because that was something that they used to do at home. So how do we ensure that routine when the child was at home is not broken once they come here? So we've we've got karate classes now for them. So we have special singing teacher who actually comes and teaches them singing.
फैसिलिटी रन्स फॉर 24 आवर्स. जो बाकी के प्रोजेक्ट है वो नाइट केयर सेंटर एंड डे केयर सेंटर है, ये 24 घंटे चलता है.
So how did you convince people to give you this center or create the space?
So I went there, I think long back in 2013. I joined Prerna as a student. I was doing internship, and during the internship Preeti Tayi offered me this job.
ये जगह किसने दी?
ये जगह हाँ सोशल कॉज पे सिडको फ्लैट से परचेस किया गया है. जो डोनर है उन्होंने परचेस करके दिया है. नौनिहाल के एसकेम करके एक प्रोजेक्ट है, उनके तहत ही आया है.
So infrastructure is ours. We just need support for the human resources and the other resources that are actually involved in rehabilitating the girls over there.
So what's the support that you're looking for?
Right now we are looking for support, for financial support to actually see that the human resources that we have, those expenses are covered.
And apart from the financial support, how can corporates partner with you?
So what we do is with our donors, we do have employee engagement activities with them. Then there are camps that they can organize. We have career sessions for these girls. So what we've realized is that corporates, they themselves have different departments where they have people specializing.
You started with saying the red light, focus on the red light areas, etc. But then as you spoke further, it seemed like the children come from everywhere. So,
Yes.
So then what is the distinction? I didn't understand that part.
So we started actually with children who were from born in the red light areas, and when we realized that there were some children who are not safe within communities. Also to add to that, it was a conscious decision to actually keep the home open to all of the children, because that is what we realized, that there was a lot of discrimination going on. कि ये red light area से ही है, so you know children should not mix around with them.
And how many girls do you have currently, and what is the how fast are the numbers increasing?
So when they say 12, last week there would have been 35 children.
Yes.
Then a set of children have been repatriated, and that depends on when they get the travel permits and the right security arrangements are being made. All of which are coordinated and supervised by Prerna.
Who provides you vocational support in terms of training and skill, upskilling?
even though there are specific requests, the network that they have with the different NGOs, if there are specific requirements coming from the girls, since we cannot predict what requirement of even for vocational, and it's a big part of their rehabilitation. And that giving it the right importance is a big, the effort that that the trainers make, their current resident trainers make, to find the additional resources to make this training happen. That is I think one of the, how actually rightly pointed out, that is a major differentiator as far as the Naunihal home is concerned.
Thank you so much.
Thank you. Thank you.
Thank you Whale Tank team so much on behalf of Rotary Club Metro and Prerna. One of our great experience has been the sort of receptiveness and the sort of questions and the willingness to know about the operations. Because sometimes in field, mostly when we work with donors, not everybody wants to know the nitty-gritty, and it was wonderful to have, people, the kind of questions that were asked in the session and the clarifications, and also about what were the different ways in which we could look for support. Well, we'll definitely be watching the next season. And we want to, because honestly, as NG, and while I'm not, I've been more in an assistive capacity, but looking at the sort of NGOs that are working, I feel that the great thing that Whale Tank does is also to bring this sort of stories up, and it's a great way to cheer on people who are doing all the hard work on the ground. So thank you so much.
Good afternoon, everybody. I'm Dr. Abhay Agrawal, surgical gastroenterologist, President West End. This is my medical director, Dr. Chinmay Sahu. He's an ophthalmologist, and my vice president, Jitendra Kamra. Greetings of the day to you.
And we run this hospital in Malad and Kandivali area. My father came to Bombay with $400 from a small village in Orissa. And while we grew up, the only thing that he ever kept saying was that you come with nothing, you go with nothing. All that you leave is the fragrance of your deeds. And giving back is the only joy that you can ever achieve. So with this kind of values, when he started a charitable hospital with the sense of giving back to community. And IBAN is a collaboration between Rotary and Sauhai Hospital. And the primary focus of this is actually to act in the field of preventing blindness. Now, during my journey through some of the most amazing institutions like Nair Hospital, Bombay, Harvard in US, Shankar Netralaya in Chennai, and LV Prasad in Hyderabad, what hit me was the amount of blindness that pervaded through communities, and especially in the rural and the urban poor. So when I came to Bombay, the first thing that struck me was that there are a lot of organizations working for cataract surgeries and giving out free cataract surgeries. But when I was in the clinic, I was getting children coming to the hospital who had numbers when they were young, they were not picked up, and they were developing lazy eye. I was getting patients who had diabetes and they were coming with bleeds, and that was very painful because the bleed in the eye is the last stage after 20 years of uncontrolled diabetes. We already have been running this project since 2015. We have almost crossed almost 822 camps in these last 6 to 7 years, and we've touched nearly 70,000 odd people. Almost 10,000 children have been detected who had numbers and they didn't know about it. So this is one of the biggest areas where the van has proven to be successful. It's a big project with AmeriCare, which is another NGO, and we target primarily the municipal schools of Mumbai, where children the families do not even have money to go to doctors to get their eyes checked. Through these last 5-6 years, few things that we learned. The van that we'd gone for was a really big van, and accessibility in a lot of areas was very difficult. Once we went to Palghar, the entire journey was took us through roads which were just not possible to go through. Urban areas in the slums, getting the van there is a big issue. The second issue was the damage to the equipment, because these are very fragile equipment which you carry, so a little heavy and bulky. So we realized that these were issues. And also the continuity of what we were doing. We were giving out free glasses, but next year around when we were going and doing a follow-up, a lot of the children were not wearing those glasses because they're broken and there was no one to go and buy it for them. So based on this, and because we've come at the end of 7 years, the van's almost now needing, it has a lot of maintenance which keeps coming up. So we've decided to go for 2 smaller vans. This is the cost breakup where we're looking at the van. Either we can go for a single van which costs around 15 to 16 lakhs and the cost of modification takes it to 20, or we can go for 2 further smaller vans. The equipments that we need, would go to around 5,17,000. The rest is the cost of maintenance, the staff salaries and miscellaneous costs, so which breakdown costs, various things that take it to around 45 lakhs. These are some of the equipments out here. So in the previous van we had bulkier equipments. Now we are going for a portable barometer which can be actually clipped.
शहर की चकाचौंध में मैं दिया लेकर निकला हूँ. कोई एक कोना तो अब भी अंधेरे में गमजदा होगा. बस उस कोने को रोशन कर दूं तो सकून सा मिलेगा.
मला नेत्रबिंदू झाले तेव्हा लय त्रास होत होता. जेवायचं सुद्धा मला जेवायचं ताट पण दिसत नव्हतं. मी तिथे गेले, मग तिथे मला त्याने तपासलं, मग औषध टाकलं डोळ्यात, मग दुसऱ्या शुक्रवारी ऑपरेशन झालं, मग मला तिथेच दिसायला लागलं. मी तुमच्या इथं दवाखान्यात आल्यापासून मी आता सगळं हातान करायले, भाकर भाजी, चहा प्यायले, चहा करायले, आंघोळ करायले, जेवण सुद्धा हातान घ्यायले, पाणी हातान घ्यायले, सगळं व्यवस्थितशीर मी आता करायला लागले. आता मी बाहेर लांब लांब जाते पुन्हा, नाही तर मला जाग्यावर पण उठता येत नव्हतं.
आपने अक्सर ये तो सुना होगा कि प्यासा कुएं के पास जाता है, पर साहू आई हॉस्पिटल और रोटरी क्लब ऑफ मुंबई नॉर्थ एंड ने एक ऐसी पहल की है जिससे कुआं प्यासे के पास जाएगा. आई केयर की अल्ट्रा मॉडर्न मशीन से सुसज्जित ये वैन जरूरतमंद लोगों के पास जाकर उनका इलाज करने में सक्षम है.
So through the van, what kind of procedures can you do?
So the van is essentially for screening.
Screening only.
And our thrust area is actually prevention, because I feel that is one area which is very neglected. A lot of emphasis goes on curative part. But patients who are getting generated, so we get a lot of patients with cataract. So we have a primary center which is a private setup, but we have our charitable wing in Kandivali, which is fully equipped to carry out surgeries. And through the camp, whenever we get patients, they are treated depending on the situation. We get subsidized by various clubs and support NGOs.
Your ask here is primarily for the vans. Now, what about the cost of the subsequent treatments or the surgeries?
So as I said, the hospital itself is subsidizing most of it. But we do get, it's like various clubs. So there are a lot of times these cataract, we have clubs which do the camps. Any cataract patient coming through them, then they get subsidized to a certain extent, where a minimal amount is taken by the hospital, the consumable cost. So when otherwise for these keratoconus patients which got detected, they needed a very specialized treatment called collagen cross-linking. So I did it, and then there were certain people who heard about it. Then you have individual donors who came forward to it. So it's happening organically,
Have you heard of this US-based NGO called Vision Spring?
Yes. So the free glasses that are being given for the old age people. So they have this thing where they give glasses for people who are reading glasses. So we partner with Vision Spring, and we are doing this in all our Vision centers. So all the 22 odd Vision centers which are running now. So Vision Spring is a partner organization for us.
I believe it was overall positive. With one of them actually mentioning that because I had quoted during my talk that all we come with is nothing and we go with nothing. All we leave behind is the fragrance of our deeds. I think that kind of connected with him, and he said that you definitely left the fragrance of your deeds through your presentation, and he seemed quite impressed about it. I think Chetan, that's what. I think it was awesome. I think
it was a great experience. For us also it was the first time, so I think it was very well done.
And a great concept.
Yeah.
To benefit a lot of people.
I mean, it's something, when you look at the CSR sector or you look at social work, it looks quite de-glam. I think this has brought a certain glam into it and made it a little more exciting. And, even for us as organizations we've been doing, just the fact that, we're going to get to present it in this manner has, I think, enthused a lot of people even down the line. So my team which works, when they heard that we are going for such kind of an event, everyone's really excited and they're all calling me, in fact, how did it go and are we going to get funded for, whatever projects we want to do. So, yeah, I think everyone feels so that, they are whatever they are doing is the fact that also that it got selected among some of these projects gets to them that self-belief that, what they're doing means something to society. So, it's been a great moral booster for us as an organization.
And a novel concept. Kudos to the Whale Tank.
We're talking about MDVI, which is multiple disability with visual impairment. Typically, we hear of disabled people who have one disability, but here we're talking about a person, a child, a youth, a grown-up adult, who has multiple disability along with visual impairment, and that's what is called an MDVI. So when you say multiple disability, we're talking about hearing impairment, we're talking about intellectual impairment, we're also talking about locomotor impairment, tons of movement, etc. So it's estimated there are more than 750,000 children in India who have such MDVI. What's special about Muskan Foundation is that we have early intervention right from the age of 3 up to the age of 18. That's the span in which they work. They have multiple therapies. We have special education with trained educators and pathways to vocational training, but we do not do vocational training. It's not a vocational training center. It's a pathway to vocational because MDVI is a very different thing from a regular disability. As a result, everybody cannot be employed per se. And then, of course, most important is parent empowerment and support. We have about 1,245 children who have been rehabilitated over a period of years. We have 52 special educators who are trained. We have 2,471 parents who have been empowered and also supported. That's the most critical thing. Most parents get desperate when your child is MDVI, and more than the public who disregard the children, their own parents sometimes can't bear with them. So that's the biggest challenge which one needs to take care of. Awareness sessions are conducted at schools, colleges, etc. because we don't promote it through advertisement, it's only through word of mouth and good words. The challenges the children face are basically lack of awareness. We sort of shed them away. We don't get to know what they are and what they're looking for. Lack of resources, hardly any resources are spent on these people. Social stigma and treatment therapy not available under one roof. So the specialty of Muskan Foundation is that we are providing them a full integrated holistic treatment. We cannot cure them. There's no way it's been cured. It cannot become normal. The only thing we can do is make them a little more into the real lifestyle of the people, how they can work along with us. So that's what we're trying to do at Muskan Foundation. The proposal we have today is to help and assist Muskan Foundation to provide them with some capital equipments to enhance the facilities. Today we have about 400 students at present who are being trained at Muskan, and we have 5 facilities. And the value of the proposal for today is about 23.14 lakh, which is a small portion of the total requirement of the Muskan Foundation. In terms of sustainability in future, this is something the model can be scaled up. When we first met her, we had just 2 centers. Today we have 5 centers. And her dream is, I can't say, 100 centers maybe. What you do makes a difference, and what you have to say what difference you want to make, and every single starfish made a difference for that boy who threw it back in the water. So our dreams to become a reality, we need partners like you, we need like-minded people like you all who want to work towards making the world a different place, a stronger place, and also specifically address the issues of people who are the neglected lot. There are hundreds of projects going on which are visible. People normally go for numbers. How many, effectively, how many do you touch? 100 lakh, 1 lakh, 1 million, 10 million, etc. But here is very few. That's why you took the example of starfish. If we can make a difference to one, I think we feel happy and proud that we are able to make that.
And where are the centers, the 4 centers?
So our main center is at Bandra East, then we have at Goregaon, and then we have 3 centers inside hospitals like Bijewadi Hospital is an hospital for children. We have Masina Hospital, and one we've just started at Panvel, it's the MGM Hospital. So when it's inside the hospital, there are better referrals, and we can work as a team there. So that's how we have.
Typically, what is the economic background of the children that you're helping as in?
Yeah, so 98% of our children are coming from low-income groups.
The centers, they cater to children of what age or till what age?
So we start as young as 6 months old. It's called a mother toddlers program. So none of the other NGOs work with them, but that's the period where the plasticity of the brain works, right? So, and we've seen miracles happening there, and the parents feel lost. They don't know what, because the doctors just tell them the prognosis or the diagnosis, but they don't know what does that mean, because most of them are uneducated. So we start working. It's a mother toddlers program. So we have that, then we have the early intervention, then we have functional academics, then we have pre-vocational, right? So from around 0 to 18 we work. So till adulthood, 18. It's 18
is the
stop.
cutoff.
Because to work with these children we need license, right? So we have a license to work for children till 18. So we don't venture into vocational because we need a different license for that, and we don't want to venture into that, but we partner. Once our children become 18, we partner with other organizations who are into vocational and we train them, because multiple disabilities is not common. So we go with them and we train them what skills they can take. But before that we've already started them on a pre-vocational program, so they know a lot about what is to be done.
One of the challenges you mentioned was also the approach towards the parents, right? So one common fear is after the parent's lifetime, what? I mean, how does the child with these complications get support? So how do we deal with those kind
National
of
Trust, there's a policy. National Trust is an act. So under that there is guardianship. So we create guardianship for our parents, where there's a guardian for the child, and the siblings or the parents are trained. So after the parents, the government has so many schemes for them.
You see, you've been working with Muskan for about 5-6 years, as you mentioned, and for donors, what kind of reporting, how do you show the mapping of progress for any potential donor?
Every quarter we prepare a report as a principle, whether Muskan or anyone else, anybody donor any CS or donation, we prepare a quarterly report. I also trust in, I think, the Tandus Bharat Foundation, we provide order purification. So there, every year we provide a quarterly report. We cannot give a quantified improvement, whether the child has grown from 10% to 12% or 15%, but we can do a progressive chart in terms of whether the movement has improved, whether the recognition has improved, whether cognitive skills improved. Every quarter we will get a report for sure. And we also encourage the donors to visit us. Visit us means along with us. Go there and see for ourselves what exactly. So there's nothing like interacting with those people to feel what you've been contributing to. It's been well thought of, well put together. I must say the Bombay Sobo Club, Rotary Club of Sobo has done a fantastic job in terms of putting this together, and we wish them all the best to make it even larger, bigger, and spread this across all the Rotary world.
I will echo AVS's thoughts and sentiments. From day one, I believe the entire project has been very well thought out, very well conceived. Communications at every stage have been awesome, and a wonderful project executed by Rotary Club of South Bombay, Subo. Congratulations to every team member who has put in every bit of effort into making a wonderful success out of this. So we're just waiting with bated breath for the result of the jury this evening.
What learning is, I always feel that people don't like to know the data. They like the stories. They not like to know what happened after the donation was given. And I saw that smile on the faces of the whales, So it's more convincing when you tell them a story than you give the data.
So my project specifically is designed for sanitation workers. We do a comprehensive health checkup for them and make them aware of the available and accessible solutions for the addiction of tobacco and alcohol. Why this particular set of beneficiary is because I feel that sanitation workers provide invaluable and essential public service irrespective of the pandemic, floods or any calamities that the city goes through. They are usually from the lower social economic strata of the society. Also, the kind of occupation or health hazard that they face, especially because of the nature of the work that forces them or indulges them into severe addictions of tobacco and alcohol, just to sublime their consciousness in order to carry out the work in filthy conditions. Because of this, they are highly prone to diseases like cancer, paralysis, stroke, heart ailments and lung diseases. There are many researches and research articles, literature reviews available that are put up by WHO, UN and very renowned journals that show the high incidence of substance abuse and high substance abuse as well as high incidences of diseases in these particular set of beneficiaries. Unfortunately, tobacco kills half of its users, and tobacco is the single and the largest, most preventable cause of death and disability in the world. Also, India is the #1 consumer of smokeless tobacco. We consume India consumes 67% of tobacco in the world. and hence we are also the global hub for cases of oral cancer. Alcohol not only causes physical hazards but also has high incidences of mental diseases, including suicide, accidents, domestic violence, especially in this strata of society. There's a lot of domestic violence and sexual harassment. We first educate them towards addictions, how to quit, why to quit, cancer signs, symptoms and self-examination. Then do a monitoring of lifestyle diseases and screening of cancer, followed by referrals for treatment to charitable hospitals or government hospitals, and then take care of the de-addiction part with the help of nicotine replacement therapies and counseling. Here is what we exactly do for each of the workers, where we monitor them for blood pressure, blood sugar, hemoglobin, dental checkup, eye checkup for vision correction, glaucoma, retinal defects and cataract. Oncology screening, cancer, oral cancer by visual examination, breast cancer by manual palpation, cervical cancer by pap smear test. After which we give them deworming medicines and supplements of iron, calcium, vitamin B12, vitamin C in order to improvise their general health. However, our main focus still stays on de-addiction, wherein we have group counseling and one-on-one counseling at the camp itself. However, the follow-up goes on for 3 to 6 months, in which we give them free access to teleconsultation services, one-on-one counseling with our psychologist and group counseling. We also refer them to support groups which are in the vicinity of their residential addresses, so that they can visit them on regular basis, which helps to reinforce motivation and also to a greater extent help in continuing sobriety. This has by far been, the referral support groups has by far been the most successful method of maintaining sobriety from any substance abuse. So dear Whales, I would I would like your support for funds and volunteers. For the ease of implementation and achieving our large and long-term goal, we have divided 33,000 sanitation workers of Mumbai according to the BMC ward in which they work. So Bombay has 24 wards. We have already finished with R South ward and G South ward. These 33,000 workers include both male and female, permanent and contractual workers. We have already received permission from the Deputy Municipal Commissioner of Solid Waste Management Department for screening and treatment of all these sanitation workers. They have also supported us for providing premises to carry out the camps in each of the ward, so that it is easier for the workers to come in. So this is my budget for 24 ward. It goes up to 43 lakhs. For each ward it comes up to 1,82,000. The cost per beneficiary is 225. However, this cost per beneficiary has not been calculated as per 33,000 workers, because in our experience only 70 to 75% of them turn up at the camp and not all of them.
For that camp that you did, were they sanitation members also? Were the sanitation members, or was it more general population?
No, only sanitation workers.
So that's your only entire focus.
Only sanitation workers.
So the numbers like 44% with high BP, high numbers.
Yes. So there was a very few amount of cases who were taking medicines but still were not aware that they need to change the medicine or the dosage or and they were just continuing with the same medication. However, majority of them did not know that they have blood pressure.
And what does 45% de-addiction mean? I mean, I saw that.
So probably 45% of them have quit tobacco and or alcohol. There are a few of them are in 2 stages of slip or relapse. However, de-addiction is the recovery process is a long one. So it will keep taking time to keep reinforcing on motivation into them or helping them.
So what kind of organization do we have for doing this? And it's going on for how many years?
The pilot was done in April 22, after which we have done one more project, and so this is just the start. Organization Rotary, we are doing it ourselves. There are few other NGOs which are involved, but they just do a part of it and they are supporting us with this.
So typically we've seen in Rotary clubs, the president takes initiative, and it's very important for the subsequent year president or thereafter for that entire passion to continue. Sometimes the new president comes in with a new cause and then old cause goes by the wayside.
No, but then we are focused only on this one cause of addiction prevention. We have no other focus. So the cause remains the same, the projects keep changing. Also in this particular project we have around 7-8 members who handle different teams. So this will be allotted to them for the next year as well.
So I think for a new club like ours, this is the best ever opportunity that we could have got. Something like a Whale Tank gives us a chance to become perfect to present our projects, and always kept us excited, and I am waiting for season 2.
At least for my 32 years experience, I have seen the Whale Tank for the first time.
In these last 20 days that I have been preparing, I have really learned what aspects to look at, what factors to be considered for making a project worthwhile and impactful.